Hello, we are discussing otitis media today, and you are welcome. So, we are saying otitis media is an inflammation of the middle ear. Alright, so before we go, let's just take a quick review of the structure of an ear. Okay, so here is the structure of an ear. Okay, an ear showing an external ear, there is a middle ear, and the internal ear. Okay. This is another diagram of the ear, and we have another diagram showing the demarcations here of the external ear, the middle ear, and the inner ear. Okay, so we have the auricle here, the helix, the tragus, the lobule. Okay, and we have the external auditory canal. Okay, then here we find the tympanic membrane, the ear oscars, which are the malleus, incus, and stems. We have the eustachian tube. That's where the middle ear is. Then we have the inner ear where there's the semicircular canal, the vestibulocochlear nerve, the cochlea, the oval window, and the round window. Alright, so now let's continue. So we had said otitis media is the inflammation of the middle ear. So the classification are as follows. Okay, so there's acute otitis media. This is an infection of the middle ear characterized by acute onset of signs and symptoms of the middle ear infection. Then you have recurrent acute otitis media. So this is when there are 3 or more episodes in 6 months with the absence of the middle ear disease between the episodes. So that is recurrent acute otitis media. Then you have persistent acute otitis media. This is when symptoms persist after initial treatment. So maybe there is a treatment that has been prescribed and the course is finished, but the signs and symptoms, they persist. So that is persistent acute otitis media. Okay, then we have otitis media with effusion. This is when there is a presence of non-purulent fluid in the middle ear cavity. Okay, so what are the causes? So we're saying the causes, there is bacterial and viral. So the bacterial, there is the Streptococcus pneumoniae, Moraxella catarrhalis, Haemophilus influenza, Pseudomonas aeruginosa. In the viral, there is a respiratory syncytial and there is a rhinovirus. Okay, so here are the stages of acute otitis media. Okay, so the first stage is the mucosa hyperemia. So mucosa hyperemia, they're saying that's where there is occlusion of the eustachian tube by inflammation. Okay, so a sense of fullness is felt by the patient. Okay, so the tympanic membrane, there is hyperemic tympanic membrane along the handle of malleus, the pars flaccida, and around the periphery. Okay, then the second one is exudation. So in exudation, that's where there is the tympanic membrane becomes more thickened and bulging, resulting in conductive hearing loss, pain, and low-grade fever. Okay, then the third one is suppuration. So under suppuration, this is where at this point now, the tympanic membrane ruptures and a pyogenic bacterial exudative infection is present in the middle ear mucosa. And you also have on a fourth, which is a resolution. So resolution, this is where now some treated cases now begin to resolve spontaneously. Okay, what are the signs and symptoms? Okay, so the signs and symptoms are as follows. There is fever, cause due to infection. There's otalgia. There's also headache. There can be also hearing loss, rhinitis, tinnitus, and otorrhea. Okay, and many more signs and symptoms. Okay, what investigations that can be done? Okay, so I'm saying you can make a diagnosis based on history and clinical picture. Okay, you can also do a pneumatic otoscopy. Okay, so a pneumatic otoscopy can show there is maybe mucosal hyperemia. They can show maybe the tympanic membrane, can be looking a bit bulgy. Okay, so what's the treatment? So the treatment, you're saying observation for 24 to 48 hours. You can observe in case it's viral, it can resolve on its own. Then you can also give analgesia to relieve pain. You can also give antibiotics to treat infection. Okay, what are the complications of acute otitis media? So you are saying cholesteatoma. Okay, so cholesteatoma, this is where there's something like a growth of a skin in the middle ear. Okay, there's also hearing loss. There's also bacterial meningitis. There's also chronic suppurative otitis media. Then there's also acute mastocytitis and many more complications that are not mentioned here. Okay, so in case the patient has been admitted, what nursing care can be there? So I've just identified 3 problems, which is acute pain, fever, and disturbed sensory perception, that is auditory. Then how will be the nursing diagnosis be? So you're saying acute pain related to inflammatory process in the middle ear, evidenced by patient verbalizing. If it's the child will be crying. Then you are saying fever related to infection, evidenced by raised body temperature reading. Okay. Then there is also disturbed sensory perception related to edema of the middle ear, evidenced by patient not responding to sound as usual. Okay, so that was our discussion today. Remember, this channel is not a substitute of school and the hospital. Until next time, bye-bye.